In Northern Ireland, about 1,500 women are diagnosed with breast cancer every single year. Also remembering that about 11 men a year in Northern Ireland will also be diagnosed with breast cancer. So what is really important is that you get to know yourself and get to know your normal. I'm Naomi Thompson, Health Improvement Manager here with Cancer Focus Northern Ireland. Welcome to today's session on breast cancer. If you're under the age of 50, 9 out of 10 lumps that are found are actually cysts and not cancer. Cancers tend to be hard, solid and immovable if they are a lump. A cyst is much more fluid-filled and much more movable. So generally for younger women, it will be a cyst and not a cancer. But it's still really important to check, really important to know yourself. And remember, your normal and your friend's normal are going to be two very different normals, and it's just getting to know yourself. Simple looking would be your first step. Do you notice a dimple or a vein or change in the skin? Has the nipple changed? Once you've looked, then the next step would be to have a feel, working your way around the breast tissue. Now if you do the breast itself first, remembering to press firmly but not poking, and don't forget under the nipple. Then go under the arm and check, because we have lymph glands under our arm. Though I will say, if you're very tired or you have an infection, you might also notice a lump in your lymph gland, so don't immediately assume that it's going to be a cancer. The other thing to remember is, don't forget that tissue just above the breast, right up to the collarbone, and just use the flat of your hand to feel, is there any change, is there any lump? Change hands to do the other side, working around in a nice circular fashion, pressing firmly, and of course up to the collarbone. So what you might feel is a lump, or you might notice a dimple. So on this particular model, she has a dimple, she has lumps. She also has an inverted nipple, or change in skin tone. It feels like an orange or orange peel. You might also notice, especially for younger women, a rash or a bleeding or bloody discharge from the nipple. It could be a vein, or you may have pain in one breast. And this is really important to remember for younger women who still have their period. During your period, you may be lumpy, you may be a bit sore during your period, so wait till the week after before you check. So if you know yourself, you'll know when anything has changed. And that's the point at which to go and make an appointment with your GP and just say, I've noticed a change. If you are over the age of 50, then you will be offered mammography every 3 years. We have a bra fitting service, and this can be very helpful to help the healing process, especially just post-surgery. And then of course, after you've had your treatments, so finding nice bras that just fit absolutely perfectly is really important. So this service is free across Northern Ireland, and just ring to make an appointment. Our lady Emma looks after all ladies very, very well, and will make you feel good again following your breast cancer diagnosis and treatment.